I will be honoring ALS Awareness Month, and I just wanted to give a quick note about this very grave neurodegenerative disease, to know that even though seeing situations in public health can be grave at times, the power of patient advocacy can change policy. About 2 years ago, there were some patient advocates who really came together to make changes to provide better access to research innovations for patients across the country, really focusing on expanding access to funding research on ALS, which was critically needed, developing public-private partnerships through the Food and Drug Administration and NIH to really accelerate how quickly these therapies can be approved, as well as a rare disease grant program that the FDA is now funding. And that was really led by patients across the country. ALS, also known as Lou Gehrig's disease, is a fatal neurodegenerative disease characterized by degeneration of cell bodies of the lower motor neurons and the gray matter of the anterior horns of the spinal cord. And whereas the initial symptom of ALS is weakness of skeletal muscles, especially those of the extremities, and whereas ALS progresses through the patients and creates difficult experiences in swallowing, talking, breathing, and eventually causes muscle atrophy, rendering the patient a functional quadriplegic. And whereas ALS does not affect a patient's mental capacity, so that the patient remains alert and aware of his or her loss of motor functions and the inevitable outcome of continued deterioration and death. And whereas on average, patients diagnosed with ALS only survive 2 to 5 years from the time of diagnosis. However, Dr. Stephen Hawking, probably the most famous person who has suffered with ALS, lived for 55 years after being diagnosed with the disease at age 21 in 1963. And whereas ALS has no known cause, means of prevention, or cure, and whereas research indicates that military veterans are approximately twice as likely to develop ALS as those who have not served in the military. And whereas ALS Awareness Month increases the public's awareness of ALS patients' circumstances and acknowledges the terrible impact this disease has not only on the patient, but on his or her family and the community. And we recognize that research being done to eradicate this horrible disease is sorely needed. Now, therefore, the Mayor and Council of Rockville, Maryland, do hereby proclaim this month, May 2023, as ALS Awareness Month in Rockville, and call upon residents to join other communities across the region to recognize and participate in this special observance. Madam Mayor, I move the proclamation.
I'll second. Motion's been made and seconded. All those in favor, please raise your hand. It is unanimous. Thank you.